Hi, my name is Vinod Saladi, and I am a faculty at the Mass Eye and Ear and also at the Mass General Cancer Center. And my lab focuses on cancer epigenetics and signaling. So I'm actually excited. I was very excited to give the talk at Chapner Colloquium today, which I've been attending 8 years as a research fellow while I was at Mass General Cancer Center. And it's one of the best platforms to present to the audience, both where you can see the interface between the basic science as well as the clinical translational science. And it's one of the places where it helps me because I also learn and also try to integrate my own basic cancer epigenetics and signaling and take it to the next level where I could translate to patients in the clinic. So it's like a transition phase for the research we do in the lab to the clinic, actually. So I've been focusing on cancer epigenetic drugs, mostly in squamous cell carcinoma, which I presented today on the EZH2 inhibitors as a potential therapeutic option to improve the checkpoint blockade, which not necessarily works in a lot of patients. It only works in a subset, like 15 to 20% of patients. The way we are trying to say it is where we can find genetic or epigenetic instances or mutations or amplifications, which could be which could work in the benefit of patients, where you could combine epigenetic inhibitors and checkpoint blockade to improve the survival rate in patients.